Greetings, everyone, and welcome to another session today. It's wonderful to have you here with us. And sorry, we seem to have started a few seconds before time. But nonetheless, that's fine, I guess. So, today, what we are having is actually a podcast. Remember, if you are somewhere where you cannot watch, you can always go to the YouTube Music app, search for Thinking Outside the Box on the list of their podcasts, and you will be able to just listen, which is also nice, and you will be able to continue with whatever else you're doing at the same time. So today's session is really a part of our professional advocacy setup. It's been the thing that we have been planning to do for the longest time. It's always been advocacy. Advocacy, as you know, has three parts. One is, of course, reaching excellence, which is what we do mostly through our educational services, but also it is about providing the opportunity for those who are trained in this field to be able to reach the patients and for patients to have access to us. Now, that is what this is about. We are having Dr. Puvan Nagpal with us, and as you can see, he has also been there before. And let me bring him in on the scene. That becomes easier.
Good evening, ma'am. Good evening, one and all. To all the viewers, my warm greetings to everyone. And thank you so much, ma'am, again for giving me the opportunity to have a talk on your show or your channel. Uh,
Um,
Thank you so much
you are
because
most welcome.
you are
So let me
also
just give a little,
like
yeah, sorry.
fulfilling one of our objectives, that is creating awareness. So,
Yes, that
great
is
job,
true.
ma'am.
Thank you. And so, of course, I think most people, at least in the last few days, definitely have come to know about Dr. Bhuvan because he just started what is called, okay, I forgot, Practicing Oral Pathologists and Oral Microbiologists Association, or very fondly called as POPMA, if I pronounced it right. He will tell us more about it. So, but otherwise, what has he been doing? So, for quite a few years, he has been dedicated and working on really getting oral pathology running, and not just walking but running in in India. We have been having a set of problems with setting up labs, with lots of discussion. Can we sign? Can we not sign? And so many little things like that. So he has already spent quite a few years, I assume, right from when he finished his MDS, which he did very well, up till now, getting all the various permissions and getting everything that's required so anybody can set a lab just like he has done. He is a lab director and senior consultant in head and neck pathology and clinical biochemistry at Tuhana Mangalam Diagnostics. That is the first and only NABL accredited medical lab in district of Fatehabad, Haryana. He's helped a number of people set up their lab. He has great experience in knowing what needs to be done. Did I sum that right?
Thank you so much, ma'am, for a nice introduction.
You are welcome. And now, another thing I will remind all of you is that there is another lecture from him, and that was Tips on Success in Oral Pathology Practice. You can find it on the channel, and the link is also down in the description. So, you definitely need to catch that also. That is the part of his journey where he got all the permissions and how he started. But coming to what is happening now, to today. So, I know starting an association is not easy. And even if you already have a law degree too, in addition to other things, but nonetheless, still that requires you to put your time and effort to set it up. It's never easy to do. So, can you tell me now why? I mean, what was behind going through all that trouble to set up such an association?
See, ma'am, one quotation, it is rightly said that necessity is the mother of invention.
Yes.
So, it is the need of the hour, which I can tell. And the need for making this association, which is in abbreviation, it is POPMA, Practicing Oral Pathologists and Microbiologists Association. The idea came in 2019, ma'am. I have written one article on delineating the scope of oral pathology and microbiology, the present scenario and the future prospects. After that article, I received many mails which are of the appreciation that you have written an article, you have given a way that we can sign, and many people have started asking for the guidance, like, sir, how we can go about it. Many postgraduates, and they have really told that what all scenario is going on, what all they are facing. So this was a basic, the spark was from that time only, that I should do something for our fraternity, that the coming generation should not face what we are facing. And initially, I was, so this was the one sense of responsibility. The onus is on us, ma'am, that we have to do something to to make the subject get back to its glory. And second thing was, like, I was initially filing RTIs, I was writing letters to ministries, to various government and legislative bodies. So that ways I was fighting alone. But when you are together for a common cause, so as rightly said, that unity is strength. So in that ways, I always wanted that we should unite a group of like-minded people who really want to practice the subject. Thirdly, there was no such association in India for practicing oral pathologists as we have for general pathology. Already, I am member for approximately, I think, 22 medical pathology associations or other associations. In that, I am member for Association of Practicing Pathologists, Haryana and India. So, such kind of pathology, oral pathology association was not there. So these were the main three reasons which made me to make an association. And this very year, in the month of May or June, I actually created a group of practicing oral pathologists, in which many practicing oral pathologists are there. And in that, I gave the promise that by this year, in 2023, I'll definitely come up with the association. So by August onwards, I started the process, and September, October, it is now ready. And we have 27 members as of now, ma'am, till date.
That's wonderful work, and that's a wonderful achievement. 27 members is really great. And so you will tell us more about the membership as we go ahead. But what about, what was the main objective and mission you have established for this association?
See, the main objective is to promote the specialty practice of oral pathology as a career in India, ma'am. This is the main objective. Still, people have the doubt that whether we can sign or not. So MDS oral pathology and microbiology is an authorized signatory as per many documents, which I would like to convey also here again, because still people have doubt. In brief, I'll tell, because our DCI curriculum is there, DCI curriculum 2007, DCI regulations 2007 and 17. So whatever is there in the DCI curriculum is that is published in the Gazette of India, Extraordinary Part 3, from page number 87 to 94. And it is a legal authorized document published by the Government of India Press, by the Department of Publications, Ministry of Housing and Urban Affairs, and which can be used as a potential primary evidence under the Section 63 of Indian Evidence Act 1872. Second things are the RTIs. During my time, when I was not able to sign initially, so I filed RTIs to 46 dental colleges. I've already told you. The replies which I have got, they are being certified by the gazetted officers, and the information which you obtain under RTI is part of the documents held by public authority, and they are also used, can also be used as secondary evidence. Even our DCI code of ethics and the DCI internship regulations, which is for 15 days. In that also they say that blood, urine, and sputum examination, and one histopathology reporting examination to be done. Then in the Ministry of Health, the minutes of the meeting, in that also it has been clearly mentioned that MDS oral pathology can sign. So all these documents are there, and I am the NABL authorized signatory also. So that also many people have used as an evidence also. So when one person is doing, why cannot the others can do? So already MDS is one of the qualification, but still getting into on the paper in a clear cut form has to be done. So that will be the second objective. And third will be to elevate the professional and scientific status of all the oral pathologists. And the mission, in short, I will say, uniting and empowering all oral pathologists is the mission of POPMA.
That's true. And right. So, having gone through the main objectives and the missions, and in that, I think you also sort of covered what were the main challenges. But what about the other challenges that now you have already been talking to people for quite a few days? Because I know there's a WhatsApp group and there's a lot of
Yes, yes.
discussion there. So, what are the main challenges that you have heard others talking about?
See, ma'am, challenges which we have as of now today for all the oral pathologists is the financial insecurity, the source of earning. That because there are the jobs are very less, whether you take it in academic institutions, the research part, even in the dental practice. Because dental practice, I am not saying that you open up a clinic. If you go to the corporate chains, they also first prefer MDS endodontics or prosthodontics, not oral pathologists. And thirdly, even the specific oral pathology practice, like the diagnostic setups or the cancer centers. So this is in a general way, and if at all they are being given job, then the salary part is very meager to lead a decent life, ma'am. I have already before also I've already told that money is an essential part. Nobody can ignore, which we never talk about it, but it's an important part of the life. And then if you want, I can tell other parts also which I have discussed with the people. Then in academics, like again the challenge is like the salary part is very less. Then on paper concept, it is there for the faculties from past many years. Recently the concept of visiting or non-attending postgraduate students have started. What it is going to do, that the dental practitioners who are already established the practice, if they are BDS, now the patients they come and ask that whether you are MDS or BDS. So in that ways they have started joining the seats of oral pathology. Already the seats of oral pathology are not getting filled, they are getting vacant, ma'am. And it's a big wake up call that our seats are getting vacant. And who all are joining at a very low amount, they are joining with I think the fees of the MDS is now less than the undergrad part. So they are joining the subject with the notion that they need not to go to the department, they will get the degree like this only. Some faculties have told that the PGs who have joined, that they have gone to take the examinations, and in that the PGs have seen the microscope for the first time. So see the kind of things, and they're literally shattered by the kind of the behavior of the managements. I can understand that it's a compulsion which our colleagues are facing. I'm not criticizing that part, but some or the other way this problem has to be sorted out. Then it is not so in um uh, the academics only, but even in the oral pathology practice part. When they go to a diagnostic center, the general pathologists have the notion, oh, only for the histopathology of this specific head and neck region or oral region, why we need, what special extra you will do which we cannot do, why we should hire you. So in that ways, I tell that if you say that you are only restricted specifically to the head and neck region without doing the allied aspects, then this kind of thing will happen. Recently, only this Sunday, I got a call from recently passed out oral pathologist. She has joined a cancer center, and she was also facing same kind of thing. I Then I guided her that you have to prove your importance or your competency to them. Thirdly, the oral pathologists who are joining cancer centers, they say that the kind of competency which they should have acquired during their PG time is lacking. And it is because of two reasons, that our curriculum, that ENT pathology part is not there, I can understand, but otherwise the getting into the depth of the curriculum is required, ma'am, which I can say. And secondly, the exposure to the diagnostic setup is also lacking. So these are the major challenges which I face that they are having.
Essentially, I think that what if we sum it up, it is like three or four things. One is that there are no jobs, because majorly
Yes,
in India we have been depending on academic jobs, which are now not
academics.
there. The second thing is, if they think of setting up outside a lab for themselves, so far there has been some amount of confusion as to whether they can or not, which luckily I think that is now sorted. And we
Yes,
know
ma'am.
that they can set up a lab. The third thing is, even when they get a job, sometimes with hospitals or other establishments, they are not recognized as equal to, say, a general pathologist or a head and neck pathologist. That's why we need
Yes.
to establish and let people know that we are essentially on par. It's just that we are sort of super specialized in one small portion of the body. That's all.
No,
But
that
that
is
also
fine,
gives
ma'am.
us a better insight into that part of the body.
That is true. That is true because many, I won't say that the odontogenic part is quite lacking in the reports of the general pathologists. For the every
Yes.
cyst, they will mention as a dental cyst, OKCs and radicular cyst and dentigerous cyst. All this differentiation part is not there, which, see, as oral pathologists, we should work as a team in the diagnostic setup. So for that, we everybody should understand. Even the oral pathologists should understand that before oral pathologists, they have the knowledge of general pathology part also. The allied aspects, they cannot ignore those aspects, which is hematology, which is the microbiology. Our subject has the name microbiology in it, serology, and
Yes.
all those things are we are doing that. So if specifically we restrict to one area, then that will be a major difficulty which one faces while getting job in the diagnostic setup these days.
That is true. And also, possibly, our training needs to be more updated to focus
That
on
is
oral
that is there.
pathology
Yes.
itself. Yes. That is
Yes.
a lot of people out there will be very upset with me for saying this, but I have always said, give away dental anatomy and histology training for our postgraduates and instead use those hours for more oral pathology training. Yes.
That is true,
If
ma'am. That is true.
Yes, if someone
We
wants to
have
go
to
and
we have to
teach,
come
then they
out.
can learn that part.
See, ma'am, now we are having a meeting. You are at Belgaum, I am at Tohana. So
Yes.
all these things were not possible some 20, 30 years back.
Yes.
And what is going to happen in another 10, 20 years? Again, it's not going to be the same. So we have to change with the time. That is the thing. When general pathologists, they say that they are they know the complete body part, and they know each and everything, they can enter into our domain. One oral pathologist said that it should be made compulsory that head and neck pathologists should only be reported by oral pathologists. How can that be
Yes.
possible when, see, the cases go to anybody, whether to general pathologist or oral pathologist? It's we have to decide. So
Yes.
many other people have that, why whether we can sign the hematology reports or other things. So I have this thing, or even they should also think that the blood which flows in our oral cavity or the head and neck structures is the same which flows in other parts of the body. So the blood, it's not going to change the chemistry, or the hematology part, it's not going to change. So whether that investigation, the hematological investigation, is done for a tooth extraction or for abdominal surgery, if it is quite different, very systemic involvement. We have a chapter of systemic involvement. So I think that answers
That's,
the question.
that does, that does. So, there are a lot of people joining us, and of course, as usual, everyone, please put in your thoughts and your questions in the chat, and we will get to them shortly. In the meanwhile, let's just talk about one more thing. Now, you have set up the group, you have the
Yes,
association.
sir.
So, what do you see as, how do you really think that this association is going to be able to help oral pathologists?
See, ma'am, first and foremost thing is that the thinking which the POPMA has, that we oral pathologists are, in true sense, are diagnosticians, because the gold standard is histopathology and other investigations. Even if we see clinically, the beauty of the pathology lies in the microscopic or the tissue level, that you know, ma'am, very well.
Yes.
So we that the conventional thinking has to, like, we have to come out of the conventional thinking, the cocoons which we have created, that we will do only the histopathology. We have to come out of it, and we have to enter into the domains. I know many people who are doing PCR reportings, so we who are doing a lot of research pertaining to other domains of oral pathology. So we have to apply those theoretical aspects into the practicality of the subject, ma'am. Then only we can practice. So this is one thing. Then everybody should understand that oral pathologists are the potential workforce who all can work in the diagnostic setup, because head and neck cancer constitutes the 65 to 70% of the cases in all the cancer centers in India, ma'am. This is my survey in almost 10 to 15 cancer centers, and it is going to be the same. Then the point of acquiring competency is a major point and a valid point, that I can help through the means of my academy. We have created an academy of oral pathology and lab medicine under the banner of POPMA. In that, various educational programs and training programs will be conducted, and through that, that competency part will be improved. In that, I'll try to incorporate the academicians, because they are the potential part. What I have learned is through my teachers only. So the academic part we cannot ignore. Either I'll collaborate with the colleges, or with other academies, or with other, because see, other institutes are also there. Malabar Cancer Center is there, Dharamshila Cancer Center is there, which are giving the fellowships. So one kind of is which will work under the banner of POPMA will be AOPLM, that is Academy of Oral Pathology and Lab Medicine. And secondly, after this, what I'm going to do is to create awareness about the oral pathologists, that they are competent people and they can report the head and neck pathologies, and they can do other allied aspects of the oral pathology to various government and legislative bodies of India, starting from our honorable prime minister, our honorable health minister, to the DCI, to various cancer centers. So the change will come slowly, but it will come, because already many cancer centers have started taking oral pathologists as one of the consultants in the team of of the oncopathologists. So these are
Great.
the ways by which
Ways.
the
Yes.
POPMA promises to take actions.
Right. Yes.
And if at all after writing also it won't help, then the last resort is that we will make personal representations, and we'll get it done. Because see, ma'am, initially I wrote letters to NABL, I wrote letter to Ministry of Health. So that change has come, that change will definitely come. Today also I was looking after the directorate of the health services at Ministry of Health and Family Welfare. So in that, I saw the other association people who have made representations there. So definitely in that ways, we'll do the representations and we'll get the change done.
Yes.
I will try to include MDS as one of the authorized signatory for the lab reports in Clinical Establishment Act also, because that is also a pending part. They have mentioned a word specialist. And when MSc and PhD people, who are actually non-medical people, when they have been given the charge to sign the reports, why can't we? We are trained oral pathologists who can actually report the investigations which are life changing for a patient, and our report can make a difference in the treatment plan also.
Now let's go to the comments. And then we will come back to the discussion again.
Yes.
So let's see what all comments we have. Of course, we have a lot of hellos from everybody. And today we have been joined by Dr. Yoetab, Professor Joss, Dr. Priyanka, Dr. Varun Rastogi, our Voice of Books, Dr. Ruben, Dr. Chintu, Dr. Richa, Dr. Manisha, Dr. Priyanka, Dr. Divya, Dr. Manish, Dr. Rahul, and Dr. Vanaki. Okay, so I announced Walla here. Now let's get to the questions or comments. So Dr. Manish has a suggestion. To improve competency, we should have study clubs for everyone to learn and eventually practice.
Yes, very well said. And hi, good evening, sir. Dr. Manish is my undergrad teacher, ma'am, and happy to see him here. Thank you so much for the suggestion, sir. And definitely, that is a part of POPMA, and I have created an academy to improve the competency, and that regularly will be taking different sort of lectures
Yes,
in that everyone can learn.
yes. And just to mention, there is also a lot of content on the channel you can learn from. There
Yes,
are over
yes, that is.
180 videos around.
I have already
You know, I
acknowledged
was just
your.
telling Dr. Manish and
Okay.
anyone else who may not know. I do realize you know you are even a member, yes. Then, what is our next one? Yes, Professor Joss has said in South Africa, we do not offer specific courses in anatomy, physiology, and biology to residents in general and OMF path. Only histology and molecular biology as first year courses and research methods. Okay. Actually, it's pretty much the same here. As residents only, I
Yes.
think in first year. No, actually, we do have everything in first year. We do the whole of anatomy, physiology, everything we do in,
Hmm.
I think, foundation in
Yes.
dentistry, we do it again. So, yep, that takes a lot of time. And what does Dr. Vaniki have to say? I'm glad you could make it, Srinivas. Anyway, emphasis should be on considering our specialty as a clinical subject in dentistry. We are doctors first and later better to call ourselves as
That is true.
stomatologists.
Excellent
Yes,
point he has raised, ma'am, and that is a true. I consider this only. That's why I said that we are pathologists
yes,
first and then specialized pathologists later on. And
yes,
it's a clinical subject. Even pathologists, they are also fighting because they consider as paraclinical branch for the general pathology part. So that's a clinical subject because it's gonna
that's a clinical. Yes,
hamper or like alter the treatment planning for the patient.
patient, yes. Professor Joss says we expect that residents read up and study the anatomy and physiology pertaining to the anatomical pathology and OMF part. Pat. So yes, I just realized I was talking about are not having dental anatomy and for our students. So, Professor Joss, the thing is here, that entire subject of what would be oral biology, I guess, plus things like tooth morphology, which includes something like carving. I don't know if everyone around the world still follows carving teeth out of wax, but that and the whole lot is handled by the oral pathology department for undergraduates. So, somehow by default, and maybe because so far we have been a mainly academic subject, so every one of our residents spends quite a bit of time learning something like, for example, like tooth carving. Really of no practical use if you're going to continue as an oral pathologist in a actual oral pathology practice. It is useful if you are teaching oral pathology, in which case, by default, you also have to teach tooth carving. But I always feel that we are not, we need to be focused more on training our postgraduates now for practicing oral pathology.
Yes,
So,
that
whatever
is
hours
the
are spent in other things can better be spent on them seeing slides.
That is true, ma'am. That is true. Quota should be implemented, and
Yes.
the peripheral postings to oncology, to dermatopathology, all those should
Yes.
be taken very seriously. I have done from JSS; it was done on a very serious note. So the all the peripheral postings should be the time duration also should be increased, and the resident should make a proper use of that time.
That time, yes. I think now almost all colleges will have the posting. I just think that even whatever time we spend on doing other things can be better used doing this. That's all.
Yes, yes.
Yes. Professor Josh says in RSA, OMF PAT is one of the six specialist disciplines in dentistry and part of the College of Pathologists in the College of Medicine of South Africa. Right. Yes. That's a good thing. So basically, they are recognized as a part of pathology.
Yes, yes, yes.
Yeah.
Even ma'am, the Royal College of Pathologists, UK. So there also, it's one of the recognized branch, ma'am,
Inches,
along
yes.
with the veterinary pathology.
Yes.
So all these branches, hematology, microbiology, all are under the RC path. They are recognized.
Yes. That is true. So, yes, Dr. Manish says we do regularly. So, I assume that's the same thing, posting students everywhere and ensuring they study everything. Okay, so we have Crystal Dental Studio. I'm facing queries from oncosurgeons whether patient undergoing oncosurgery face issues claiming MA card if the report is from oral pathology. Okay, can you answer this?
I am not able to get what is MAA card, ma'am.
Yeah, can you tell us what is the full form for that? Maybe one of the government, the
That is there,
different,
ma'am.
yes,
I should tell you, you have to educate them. Here also, when I sign the reports for many insurance claims, so sometimes the query comes. But when you tell and show them the proofs that you are authorized by the government body, then such query goes off. That's not an issue. See, head and neck pathology, if oncos are the specimen which has come from the head and neck part, and if oral pathologist is signing it, then I think it should not be a problem. It's just that they are not aware of the same thing. If the part is from a different body part, then it can be an issue because histopathology, head and neck, we can report,
true.
and
And I think we have
cytopathology
enough
also.
documentation to send it.
Yes, yes,
A
yes,
little bit, I
yes,
think,
yes.
of the advocacy is also now to not keep quiet
Yes, yes,
for
that is there,
individuals.
ma'am.
Yes, if someone
I,
returns
I,
back
I'll
something,
tell
you can
you,
always raise your voice.
I'll tell you one story, ma'am. A recently passed out girl, she has joined Metropolis in Chennai, not only in north part. I would like to name also Dr. Gauri Shantakumar. She has just finished her PG, and she called me to take the guidance. Then in that she asked, "Sir, what should I do?" So I guided her that you try to like search options for in the diagnostic industry. So she landed up in Metropolis, and they have hired as a trainee initially, and after 6 months they will give her the post. So like that, it's a corporate chain, Metropolis Healthcare Labs.
So that works. Yes, that's true.
I think they
Exactly.
have
We
written
just need to
Ma
keep
Amrutam
trying different
Yojana.
things. Yeah, here
It
it is.
is
I think is the full
MAA Ma
form.
Amrutam Yojana.
Yeah. So it
I
it
think
is, I
they should,
assume, one of the government these ones.
or maybe the private Yojana, or the government one. In that, you can take my email ID, and I'll definitely forward you all the requisite legal documents through which you can, like, if the histopathology is pertaining to head and neck region.
That's true. Okay, we also have another comment. Right. Okay, Dr. Nandini says, thank you for conducting this much needed session. And such an association is the need of the hour. Kindly guide us on joining it. Yes, that's a session, part of the session we are still getting to. Yes. And Professor Hill is saying, what about the oral microbiology part of POPMA?
See, oral microbiology part is, sir, that's again an essential part of oral pathology and microbiology. So, what exactly, sir, you want to know about the microbiology part? The sessions which all be there will include the microbiology part also. The different diseases, the kind of infections, or the routine microbiology which we can learn through that. So that will be a part, and we can sign the reports. I'm signing sputum reports, KOH reports, uh, all those routine gram staining reports. So those things will be there, and it's an essential part of POPMA, because we are in the degree it says oral pathology and microbiology, so that microbiology is not separated from oral pathology. It will remain a part of oral pathology unless and until it becomes a separate entity later on. So it will be a part of that.
True. So, uh, right, let's see if there's any other comment. I think we have covered most of it. Okay, so in this intervening time now, you can tell us about how someone can join the organization.
Okay, ma'am. Joining organization is anyone who has a healthcare or health science degree, whether it is from medicine, dentistry, veterinary, for biotechnology, or from the technological part, or from basic medical sciences. They can become member. They should have attained 21 years of age, should be of good mindset, and they should abide by the rules and regulations of POPMA, and should not have any kind of case of any moral turpitude. So they can become members. I have made it a vast one because we require people from different domains to join the organization. It's not only that only oral pathology, because oral pathology and microbiology is again an overlapping branch. It's a branch of dentistry also, it's a branch of medicine also, and it's a branch of pathology also. So even general pathologists are member, general microbiologists are member, biochemist is also a member, biotechnologist is also a member. Bulk are oral pathologists and microbiologists, but from other domain also people can become member.
Right. So there's a form
And
to be
even
filled
from
up.
the other part, but they should have an active interest in oral pathology. And the reason why I have created one is like when different domain people are there, no, it will instead create a kind of awareness among them also, that a branch, a specialized branch is there, in which the doctors who deal with such domain, with the domain of head and neck region, with all those structures. So they are the specialized ones who can be a part of diagnostic setup. Because even in ma'am, I should tell you, the molecular tests, even general pathologists are not competent or not entitled to report. Many tests are there in which only the PhD people, the molecular tests, the PhD people who are from the basic sciences background, they are reporting. Even in the great corporate labs, even the PCRs, even MD microbiology can report, and some PhD from biotechnology part and PhD microbiology part, they can also report those investigations. So this was the reason I considered other investigations also to become member.
Yes. No, that's a very good thing, in fact, to have people
And it
from
is not
different
only
areas.
my thing, ma'am, which I have considered internationally. American Academy of Oral and Maxillofacial Pathology, which dates back to 1948, when they can consider that thing, why not we should also consider that. Even the some general pathology organizations, they have considered MDS oral pathology also. They can become associate members. Veterinary pathology also to become associate members.
Very true. And basically, it really helps to have others, because once we actually begin to explain to others, just meeting us and knowing that there is an association that they can join will get them to ask, so what's an oral pathologist? And that helps.
Yes, yes.
Yes.
Recently, one general biochemist, he became member, and he told that you add a word biochemist also in this. So later on, I'll think
Yes.
of because that
True.
is also again an essential part of it, ma'am. We do lot of
Yes.
biochemical tests also pertaining to our oral lesions, ma'am.
Very true. Okay, we have one comment. Dr. Nandini says, sir, kindly shed some light on the concept and idea of starting an oral pathology practice parallelly with our dental clinic setup.
See, ma'am, many people, while running the general dental practice, they are practicing oral pathology. First and foremost, I'll suggest them that they should make it a separate entity, not along with the practice, because that kind of insecurity with the clinicians, they will not send samples to you. First and foremost thing. And secondly, for the practice, you need a good outsourced lab to which you can send your samples. You gross the sample, uh, put it in the cassettes, and then your person should be there. He takes it there. Some logistic person should be there, and he takes that sample to that lab, to that histotechnician, and he processes, gives you the block and the slide, and then you report. So that will be more of a oral pathology consultancy. To have a histopathology setup, it's not advisable at this moment. I really I will not guide anyone like to start a histopathology setup initially unless they have a load of some 2000 to 3000 specimens per year, because
Yes,
otherwise it's not a viable option. And having both the things, like if you keep a OPG with you or a CBCT with you and you have a simultaneously running practice, then it's a human nature that the other clinician who thinks you to be as a competitor, they will never send you that case to you, because their mindset will always be like this, that your patient will not turn up back to you. So this is
that's true.
what I have understood from my experience over a period of time in the private practice.
Yes, it is definitely better to separate the two entities. If you already have a dental clinic, if you don't have one, even I would suggest that you actually,
You make
instead
it
of
as a
spending
consultancy,
time,
oral pathology
yeah,
consultancy, or a lab only, in which you outsource your specimens to a big lab. You get your blocks and slides. You report it, make your own letter pad, and then sign it. Sign out all those reports with your name.
very true. Definitely, I mean, you have to sign out your reports, but Uh, Also, like you said, it's a very good point for our colleagues, our younger colleagues, to remember that if you set up a concurrent dental practice in a community today, in a situation where there are dentists, there are probably three or four dentists on every road. So you just become another competitor. On the other hand, if you stay as just a dedicated oral pathology practice, they don't see you as a competitor. In fact, you can go to them and ask them to send you cases, and they probably would like to, because rather than you working as a dentist and being competition, it's always better doing. I mean, sending you tissues is in no way, you know, extending into their practice or limiting their practice. In fact, it helps them also. Right.
That's true,
So,
ma'am. Mm,
Dr. Ashwini says a great lecture. Thank you for attending. So, we have one or two more questions that we need to cover up. One of them is, so what about the organizational structure of POPMA?
Ma'am, organizational structure, we see initially to set up the any society now or a association. The guidelines are like this, that you, when seven people then they join together, they can make an association at a state level. Whenever an association is made, initially it is at a state level. So our association is registered under the Haryana Registration and Registrar Society 2012. That act is HRS 2012. That act is known as. So seven members are there, and in that those are the seven are the founder members. Apart from that, we have a total capping of 500 members, which can be increased later on after passing a resolution. So 250 will be the life members, 243 will be the ordinary members. The ordinary members, they can like renew after a year, because that will be they will be the annual members. So initially when I made and I have sent to people, they have a question that the area of operation written was Haryana. So, but now I wanted to tell that initially it was Haryana, but now we have members from more than 11 states. So, and the rule is a rule which says that when you have members from 8 different states of India, then the operation of the organization becomes pan India. So, already it is pan India, and the resolution for the same has already been passed. Then in the governing body, we have two bodies. The governing body has the president, the general secretary, the vice president, joint secretary, treasurer, and two executive members. The general body is the one in which the other members they become the general body. And after that, I wanted to say that there will be one AGM, that is annual general meeting or the general body meeting, and four governing body meetings. So the president, I am the founder president. Dr. Anupam is the vice president. Dr. Priyanka Mittal is the general secretary. Dr. Ambar Agarwal is the joint secretary. Dr. Anuj Kalada is treasurer, and two executive members are Dr. Raman Mittal and Dr. R. N. Nagpal. So this is the governing body as of now, and will after this, ma'am, with the complete democratic process, and will change as and when or the time passes.
Yes, naturally, it's early days. The fact that you have even taken so much into consideration is itself great.
And
And
who the
yeah,
members who are from the different states, I'll make state representatives, so that the oral pathologists who face problem in that particular state, that one person should be there who can address their problems, so that they should not be like non like their problems should be addressed, whatever the problems they face, either in the practice or some any other kind of problem, so pertaining to the practice, that can be addressed. So state representatives will be there.
yes, true. And just one more question. I mean, since we have Professor Joss with us from South Africa, so are you ever going to make this international?
I have not thought about it, ma'am. Seriously. And
It's something to think about.
yeah, first,
Yes.
the my friends in India, they should be happy and prosperous, and they should be very motivating for the subject. I think my international tour is there only then.
Yes, but the what we often forget that we are the largest fraternity of oral pathologists in
Yes,
the world.
yes, yes, yes.
So it
That
is
is
up
there.
to us
That
in
is
a
there.
lot of ways to set examples for others too.
That is true, ma'am.
Yes, so that's something else you got to think about. Anyway, it's something to think about as you go ahead. Okay, let's see. Yes, Dr. Arvinda has joined us. Yes, good evening to you too. And Dr. Akshay has also joined. And Dr. Arvind is saying good evening to you also. Yes,
Good evening, Dr. Aravinda. How are you?
yes. And he is telling you that
Dr.
it's a very good
Aravinda is also
initiative.
he really helped when initially Dr. Arpan Shah and Dr. Aravinda, I shared the constitution with them only, like to see if any things they wanted to add on. So thank you so much, both of they are like brothers only. So they helped me a lot in that ways,
Yes,
and
Dr.
many
Arvind
other
is a
people are there.
very, and even Dr. Arpan, I think both of them. I
Yes,
haven't
yes,
met
both
Dr.
are.
Arpan, but Dr. Arvind I have met and has been on the channel also. Extremely passionate about oral pathology, I can say that.
Yes, yes,
So
yes.
I'm sure he'll be
He is
great
doing
help
a lot
even
of
as you go on.
good help in clinical oral pathology.
Yes. Then we have Dr. Akshay. Can we start clinically oriented case discussion and journal clubs monthly or weekly? What we see is there are a lot of discrepancy in diagnosis and reporting. Yes.
Yes, we can. That's a part of it. Dr. Akshay, you can become member of POPMA, and I think by December or January we are going to start with the academy part. The AOPLM works will be started, and case related discussions, journal clubs will be there. I'll be taking initially the hematology or the basic overview of the diagnostic setup. And yes, there will be a lot of discrepancy in diagnosis because it's a subjective field. You see something,
Yes.
I see something, and that's only the kind of like interpretation. But we have
Yes.
to always join the clues which are common, and then should come to a conclusion.
Conclusion. That's
Yes,
true.
definitely that can be done.
Professor Hill says it's good to have POPMA for India first and then affiliate with IOP eventually. Good idea.
Yes, yes, definitely.
So, oh, Dr. Suresh Parpande sir is with us. Good evening, sir. That is all right. Whenever you join is great. Thank you for joining us. Okay, now another thing, while I'll just give everyone a few more minutes. We are anyway probably just 6 minutes before finishing, but giving you time to put in your comments and thoughts. In the meanwhile, tell me, how do you like the new background video? Is it nice, or is it distracting? Or if you think it's nice, you can just put a thumbs up. And it was just something I made. It's a variation on the world map, which is normally there behind, but yeah, I just sort of jazzed it up a little bit. So let me know how you like it. And okay, there we got a question, I think. Professor Hill says in South Africa, the Society of Oral Pathology and Oral Microbiology collapsed years ago because of the college affiliation and HPCSA designation as one of six dental specialties. I'm not sure how that worked. The Society of Oral Pathology collapsed. Are you meaning that the that particular society or association collapsed, or basically oral pathology had a problem? I'm a little confused. Okay, Dr. Manish likes it, likes the background. Thank you.
No,
Yes,
it's
and he
good.
also says it's jazzed. Yes. I have realized in the last 3 years that what we do also has to have the show. It's online. It has a very different set of requirements compared to what we would get together and have a very serious looking lecture. Online, you need to have a little bit of show if you want to get people to actually stay connected. Dr. Aditya Garg. Yes, good evening. And he says a nice initiative. Yes. Okay. Dr. Garima also says, great discussion and much needed. Thanks. You're most welcome. Okay, I think we're getting a question from Crystal Dental Studio. So, can we sign a report under a clinic's name, letterpad, or it should be under our name as a consultant?
It should be under the name as a consultant, or you can make it as a consultancy. Better, because it's a consultancy. You nobody clinic that letterpad does not make a meaning actually, because you do procedures in a clinic. So, or you have to, like, if you can make it like this, that so and so XYZ consultancy inside so and so clinic, and then the consultant's name. See, whenever you sign, your name should be there, your registration number should be there, your degree should be there, and that and all should be there, because by that you are making aware that such and such person has signed the report. I have already discussed that why we sign, because signing gives the credibility. We become liable for that reporting, and whenever you have written all those things, they do matter. So even in our NABL, it is very important. I have, what all reports I am signing, I have written MDS oral pathology and microbiology with my registration number and my designation.
Yes. I think in a
It's
lot
better
of
to
ways it's
have.
very similar to the way what you need to have if you are writing a prescription.
Yes, yes, that is
It's the same
the
same.
same way. Because on that, on the letterhead of my lab, uh, uh, I cannot write any prescription. I'll just write my report. And yes, as sir has mentioned, yes, signing and stamp is very important.
Yes,
Your registration number should be there, that you are a registered practitioner.
very true. That is required, yes. Okay. Okay, Professor Hill has cleared that it was the Society of Oral Pathology and Microbiology that collapsed. Very sad. Maybe you can restart it with time. And okay, we have with us one of our members. You might have noticed. Uh, although this
Yeah,
has come here as you got this, but he
Dr.
also is,
Garima is, she is the
yeah.
member.
No,
Dr.
I meant
Priyanka,
members
she
of
is.
Oral Pathology 360. Sorry. Okay.
Okay, okay, okay.
Yeah, like you. You are
Ah,
also
yes,
one of
yes,
the members.
I am
Yes, you
also one of the members.
members. Yes, and any of you would like to join, there is a join button now that you will be able to see below. So please click it, check out what it is. Basically, it's a small monthly fee that will help us continue with what we are doing and bring you more greater content. And right, Dr. Ashwini. Oh, okay, she likes the background. Nice. Okay. Dr. Vivek says, great initiative, sir. My good luck and best wishes for future endeavors. Right.
Thank you so much, Dr. Vivek Gupta.
I think it is basically good luck to everybody. It's a collective thing, it's not just your thing, it's everybody's thing.
Okay,
In
no,
some
because
ways,
he
very
is
like
into.
oral pathology 360, it is everybody's thing. So,
Okay.
We hope it will do well, and we will all be there to help through. And at the end, what matters is getting the kind of recognition we want for oral
Yes.
pathology and microbiology. And really, not just because the way, at least this is the way I see it, is that not just because we have oral pathologists who need a job, not really just because of that. Jobs can be got in different ways. But
Yes, it
because
is.
really oral pathology and microbiology is a very fundamental part of what patients need, and
That's
we
true,
need to
ma'am.
be able to get it to patients. So that's the way I see it. That's why I'm doing all this. Of course, it is a good thing at the side. Also, of course, if oral pathologists are doing very well, nothing wrong with that. Do a lot of years of studies to get here. So, yes, definitely should do well. Okay, Dr. Piyush also has said good evening. Right. I think we are almost good evening to you too, Dr. Piyush,
He is
and
the
thank you for
first
joining us.
postgraduate student to become member, ma'am. Dr.
Wow, that
Piyush
is nice.
Asnani, he's from Gujarat. He's the first
Very, very
postgraduate
nice.
student to become member.
Very, very nice. Okay, so that's good. Right. So let me just share. Let's let me share with everybody what is next week, and then we will come back again. So next week we are continuing with Dr. Keith's lecture, the second part on tooth pathology. And if you missed the first part, please go and watch it. It is, of course, on the channel. And that will be, as usual, on Tuesday, our regular time. So that is about what we are going to be doing coming week. And I think there are no more questions, and we are already on time. So let's just, yes, let me give you your little certificate. Thank you.
Thank you so much, ma'am.
And
Thank you, ma'am.
you're most welcome. And I do hope that those stars will follow oral pathology very soon.
Yeah,
We have
will
one
be.
last
I'll be
comment.
working with my utmost sincerity, hard work, and dedication, ma'am, to make to bring back the glory to our subject, ma'am.
Yes. I have to say, I don't think you will be working. I think you have been working. You'll just continue doing it. So
Thank you so much.
you're most welcome. Okay, closing comment. So Dr. Akshay says to enter a head and neck cancer institute is also what we should talk about. Creating opportunities in hospitals is needed, representation is needed in cancer hospital. Looking at the oral cancer burden. Yes, that is true. That is where we are
That is
needed.
there. And that is one of the main ideas which we are going to do, ma'am. We are going to write to all the cancer centers in India. I've already jotted down the email IDs and the addresses. So we'll be working on it from January 2024, ma'am.
Wonderful. Maybe we can try one of those things. What was that? The causes that you could collect so many signatures to submit a cause. So maybe we can do
Yes,
that.
that is
We
also
can
there,
get the
ma'am. But
common
when it
people also
goes,
behind us. It's not just us.
yes, yes.
Yes. Okay. So thank you everybody for being with us. Thank you, Dr. Bhuvan. Wish you and the
Thank you, ma'am. Thank you so
association
much.
great, great. You're most welcome. Thank you for coming here, everyone. And continue and do very well. We will have another meeting here in a few months to check what's been happening. Okay. Right. Thank you, everybody. See you
Okay,
all.
ma'am.
Have a
Okay.
wonderful, wonderful week. And we'll catch you on Tuesday.
Yes, ma'am.